Good morning, everybody. I'm delighted to be here this morning presenting about compassionate leadership for quality care with Professor Michael West, who I've been watching and admiring and using his work for many, many years. I'm delighted that we can be doing this masterclass together because I feel that in maternity services particularly, we've got a lot to learn. So I'd just like to introduce now Professor Michael West, who's going to begin the session, and then I'll follow on with my slides relating to maternity care. So thank you so much, Michael.
Pleasure. Thank you, Sheena. I'm delighted to be a part of the International Maternity Experience Conference, and it's a real pleasure to share a platform with you. You've had so much positive influence on maternity care internationally, and it's a privilege to be a part of this event this morning. So the last months have been very difficult for all of us around the world. There has been huge tragedy and pain and very high levels of fear, much loss, much grief, and great difficulty. And it's having, I think, a sustained effect in that the process of dealing with this pandemic is going on for some period of time. And I think what's been, for me, most striking is how compassion has been the key factor that has helped us all to cope with the challenges that we've been facing. Compassion is fundamental in human behavior. It helps us to connect, to feel a sense of belonging, and to cope in the face of fear. And I think that the pandemic, dark times it has been, has awakened us to the need to really focus on compassion professionally and in our societies and communities more generally. Compassion, I think, is at the heart of health and care. And I want to explore with you this morning how compassionate leadership is so important in maternity care and in all healthcare. So what is fascinating about compassion is that we see in neuroscience studies that when we ask people to be sympathetic, empathic with another person in pain, what we see is that that's associated with the activation of pain centers in the brain. That's not surprising because when we empathize with another person, when we sympathize, we are in some sense putting ourselves emotionally in their position, and so we feel their pain. When people are asked to be compassionate, on the other hand, to augment, as it were, their empathy with an intent to help, with helping the other, then we see that that's associated with the reward centers of the brain. And in a way that's both illustrative and also not surprising. It illustrates how altruism, compassion are inbuilt to us as human beings. We're hardwired to be altruistic, to help each other, because by helping each other, we survive more effectively. And I want to show you some of the research results that indicate the power of compassion in healthcare as a way of illustrating the power of this behavior. So if we look at, this is taken from a recently published book called Compassionomics, which reviews all of the literature on compassion in healthcare. And I'm not going to go through all of these points, but just to say that most of these studies are large-scale studies, or they're randomized controlled trials, or they're meta-analyses. For example, they show that compassion from anesthetists who visit patients pre-surgery, that's associated with, when we compare this with sedatives given before surgery, that compassion is associated with patients feeling calm but not drowsy, whereas when patients are simply given sedatives and a normal visit from an anesthetist, They're drowsy but not calm. Post-surgery, those who have the compassionate intervention experience a 50% lower requirement for painkillers, and their stay in hospital is considerably shorter. One study, randomized controlled trial of patients with an early terminal cancer diagnosis, showed that those assigned to early palliative care rather than normal cancer care survived on average 30% longer. We see similar effects with long-term conditions like diabetes and the treatment of HIV patients. Those with clinicians who are asked to provide compassionate interactions have a much higher adherence to their therapy and much lower odds of the virus being detected in the blood. Fascinatingly, it's interesting to note that though clinicians say they don't have time to be compassionate, 55% of them, in studies of nurses, doctors, midwives, compassion doesn't appear to affect encounter length. And equally importantly, we see that when clinicians, nurses, doctors, midwives show compassion, that it has a significant positive effect on their well-being, with lower levels of depression, anxiety, and distress. And the research goes on to demonstrate that costs are much lower when clinicians are compassionate, and there are fewer referrals for further treatment. The size of these effects is, as you can see on the slide, greater than the effects of aspirin in heart attacks and of statins in a 5-year risk of cardiovascular event. And in maternity care, Sheena, Byrom and Sue Down's book, The Roar Behind the Silence, has demonstrated utterly convincingly how fundamental, how central compassion is in maternity care. Forgive me. Yeah. It was my daughter calling me.
Oh, that's lovely.
And the size of the effects of compassion, the size of the effects of compassion are huge. The size of effects is greater, as you can see on the slide, than the effects of aspirin in heart attacks and of statins in 5-year risk of a cardiovascular event. And in maternity care, as Sheena, Byrom and Sue Down's book, The Roar Behind the Silence, has unequivocally demonstrated, compassion, kindness, care, respect are fundamental to providing high quality maternity care. So the challenge for us then is, how do we create the conditions within our organizations where staff, midwives, maternity assistants will give the high quality compassionate care that women want and that they themselves want to deliver? And the answer to that question is that it's about the culture of our organizations. Culture is the most powerful influence on behavior in our healthcare organizations. So how do we shape culture? Well, every interaction by every one of us every day shapes the culture of our organizations. How positive we are, how warm we are, how irritable we are, how cynical we are, how kind we are, how compassionate we are in every interaction between staff as well as with the people we care for. Every interaction every day shapes the culture of our organizations. But the role of leaders is particularly powerful. What leaders pay attention to, what they focus on, what they monitor, what they reward, and what they model in their own behavior tells us what it is that they value. So it's vital then that leaders model compassion in their behavior if we're to create compassionate cultures. So what is compassion? Well, in practice, it's 4 key behaviors. It's first of all being present with the other person, paying attention to them. Nancy Klein says it's about listening with fascination. Second, it's seeking to have an understanding of the challenges that the other person faces, not by imposing our understanding, but through a dialogue arriving at a shared understanding. Third, it's about empathizing with the other, putting ourselves in their position, feeling what they feel without being overwhelmed by the feelings. And fourth, it's about helping the other to deal with their distress or helping them in practical ways. So leaders must embody these four behaviors in their leadership. And what that means in practice is leaders being present with those they lead, attending to them, listening with fascination. Leaders who seek to understand the challenges that those they lead face. Leaders who empathize with those they lead. And leaders who then seek to help by removing obstacles that get in the way of people delivering high quality care, or ensuring they have the resources they need, technical resources, staff, equipment, training, whatever. This is fundamentally important. When we look at the levels of stress amongst those working in healthcare internationally, they are extremely high. We're damaging the health and well-being of the very large proportion of people who deliver health and care and maternity services around the world. Here in the United Kingdom, midwives have the highest levels of stress of any category of nursing and midwifery across the United Kingdom. Over half of them report being unwell as a result of stress at work during the previous year. So compassionate leadership is important because compassion is at the heart of care, but also because it's clear we're not looking after those who deliver health and care services. So it's fundamental. And let me say that compassionate leadership is not soft cushions and scented candles. Being present with those we lead and listening to them will mean that we hear things we find uncomfortable about lack of resources or lack of staffing or conflicts. Seeking to have a shared understanding means that we have to work through differences in our perceptions of what the challenges are. Empathizing means that we have to feel their pain without being overwhelmed by it. And as I said, the levels of distress amongst care workers internationally are extremely high. And fourth, it means recognizing that our role as leaders is to help. What we know from an enormous amount of research is that these four behaviors are critical to effective leadership generally. And it's no coincidence that they are the same as those behaviors that characterize compassion, because compassion is about connecting. Good leadership is about connecting. We in the United Kingdom, in England, in our health service, have been running a staff survey now for 18 years, with over 250,000 responses every year from that staff survey. And we're able to link the data that staff provide to key outcome data, such as patient satisfaction, care quality, financial performance, and in the acute sector, patient mortality. And what the analysis of those data show over the last 18 years, consistently over time, is that leadership and staff experience are the most important determinants of the outcomes that we're concerned about. Staff views of their leaders predict patient satisfaction. Staff experience predicts patient satisfaction. Where staff report high work pressure, patients say they're not given the privacy that they wanted, they're not treated with dignity or respect, they're shown less compassion. Where staff report high levels of work stress or poor levels of well-being, then staff report that they're not able to deliver the quality of care they would like to deliver. Audit ratings of care quality show care quality is significantly worse. Financial performance in those organizations is significantly worse. And in the acute sector, patient mortality is significantly higher. So staff experience is fundamental, and leadership is key to that. Now, I think it's also important to say that compassionate leadership requires courage. As I said, it's not simply scented candles and soft cushions. Compassionate leadership in maternity care is also about providing effective leadership. After all, ultimately, our compassion as leaders is for the women and the families that we're caring for. It's about inclusive leadership. If leadership is not inclusive, it's not compassionate. It's about collective leadership and system leadership. Effective leadership means leaders ensuring there's clear direction, a vision of what we're trying to achieve. It's about ensuring that everybody's efforts are focused on achieving that vision. For example, providing high quality, continually improving and compassionate care for women and families. And it's about building commitment by ensuring trust and motivation among staff. And I'll say a little more about that in a moment. Compassionate leadership, as I've said, is inclusive leadership. What we've seen during the pandemic is the tragic and disproportionate effect of the pandemic upon people from minority ethnic groups. And we've seen here in the United Kingdom disproportionate effects on deaths among staff from the virus amongst people from minority ethnic groups. Compassionate leadership is ensuring that our leadership is inclusive, that everybody feels included by our leadership. And it's ensuring collective leadership where everyone feels that they have leadership responsibility and the right to lead, where there's shared leadership in teams, which we know is what characterizes effective team working, and where there are consistent approaches to leadership, characterized by authenticity, by openness and honesty, by humility rather than narcissism, by optimism and by appreciativeness. And it's about ensuring that our leadership is leadership across boundaries, cooperating with those in other teams, departments, directorates, organizations. One of the things we've seen during the pandemic is its examples of excellent collaboration and cooperation across the health and care sector. So how can, as compassionate leaders, how can we ensure trust and commitment of our staff in addition to attending, understanding, empathizing and helping? It's understanding what people's core needs are at work. And we've just completed a review of the mental health and well-being of nurses and midwives across the UK and reviewed the international literature. And from that, it's clear that there's general agreement that people have three core needs at work, all of which must be met. And the three core needs are the need for autonomy and control, to feel that we have control over our work life and we're able to act consistently with our values and provide high quality care for those that we are serving, rather than coming away from work feeling we were so pressured that we didn't have time to provide the care and the compassion that we felt we should. And that's about making sure that all who work in maternity have influence over decisions about how care is structured and delivered, ways of working and organizational culture. It's about ensuring that midwives have influence within the structures and the governance of their organizations, but also those who are working, as it were, at the front line with women and families. Their voices are heard, they have influence over how care is delivered and decisions are made. It's about ensuring that we have as well just and fair environments, because when we work in organizations where we feel decisions are made in just and fair ways, rather than where there's a continual focus on blame and shifting responsibility, when we have confidence in justice and fairness, then we have that sense of autonomy and control. And that's about creating equity where all staff are treated fairly, regardless of differences between them, whether it's ethnic minority, group background, sexuality, religion, color of skin, whatever, that everyone is treated fairly, where diversity and difference is seen as a positive, and where there is a sense of everybody being included. And it's about making sure that basic work conditions and work schedules are enabling people to feel a sense of control, having access to hot food, nutritious food, to basic hydration, to having places to rest, to having work schedules and rotas that we feel we have some control over. Secondly, it's about ensuring that people have a sense of belonging. It's important that we feel that we work in teams where we feel connected, where we feel cared for, and we care for those around us. And that means people working in effectively functioning teams, and ideally multidisciplinary teams, where hierarchy and professional differences don't corrode the ability of the team to work effectively together. And as I said earlier, we know that shared leadership and mutual respect in teams are key to effective team working. And this has been a long-standing issue in maternity care. And we have to get it right, because the team is the domain within which people's work experience is most profoundly and immediately affected. And it's also about creating cultures, which is what we're talking about today, of belonging and compassion, where there are cultures that nurture compassionate leadership and that enable high quality, continually improving and compassionate care. And third is the importance of people being able to have a sense of making a valued contribution. It's the need to experience effectiveness in our work and deliver valued outcomes. And I think the factor that is most undermining our ability to meet that need in midwifery is the problem of chronic excessive workload. I think often in midwifery and in healthcare generally, we treat chronic excessive workload as rather like the pattern on the wallpaper that we no longer see. Chronic excessive workload is the number one predictor of staff stress. It's the number one predictor of patient dissatisfaction. It's the number one predictor of staff intention to quit. And what we've seen in maternity care is increasing complexity and increasing demand, particularly during the pandemic, and people being subjected to chronic excessive workloads, resulting in high levels of stress. And we know that stress in these contexts is generally chronic rather than transient. And that kind of stress is what does so much damage to human health, in terms of cardiovascular disease, diabetes, addictions, cancers, and of course mental health problems. So if we're not addressing the problem of chronic excessive workload in maternity care, then we're not addressing what is the most, I think, important factor affecting the well-being of midwives, maternity assistants, and so on. And it's about, and we see, by the way, plenty of examples of organizations where these issues are being addressed effectively by ensuring adequate staffing, by eradicating unnecessary work, by building more effective multidisciplinary teams, by using technology more effectively, by engaging communities and families more effectively. And it's about making sure that all those working in maternity care have regular supportive supervision and reflective learning in order that they can address problems that they're encountering in their work. And finally, it's about ensuring the continuing growth and development of people through training, through new work experiences, through new challenges. All of those three needs have to be met for people to thrive at work. What I'm saying, I think, can be summed up by saying that what we have to do is create conditions in maternity care where professionals experience a sense of psychological safety, where they feel safe in their work. And that means making sure that we have clear shared vision, values and objectives, in the work that we do, making sure that we're working in climates that are characterized by a focus on innovation and learning, quality improvement and reflection. We know, for example, that teams that take time out on a regular basis to review what they're trying to achieve and how they're going about it are between 35 and 40% more productive than teams that don't, and teams that continue to just spin the hamster wheel. It's about ensuring that we have frequent contact with each other in our teams, with our leaders, with our supervisors, positive contact, focused around delivering high quality care, around learning, around mutual support. Psychological safety is created, is nurtured when we value difference, whether it's professional differences or differences of opinion or differences of demographic background. It's about recognizing that we have to deal positively, courageously with conflict. Interpersonal conflict is a disaster for team working in health and care. Conflict over how we do things, what we should do, when approached as an important way of improving quality, can help us be more creative. So we have to, I think, approach conflict in our teams and organizations, unless it's interpersonal conflict, which should never be allowed to get in the way of our professionalism in delivering care for the women that we serve. Conflict over how we do the work and the way we work together should be approached in a positive, constructive way, to recognize that when we work through those conflicts in the best interests of the women we serve, we create more psychological safety. And it's about mutual support, compassion and humility. What we've seen during this pandemic is how professionals have supported each other, whether it's bringing someone who we see is under pressure a hot drink, a coffee, a tea, whether it's a hug when someone is clearly under huge pressure, but team members supporting each other continually. Combined with compassionate leadership and effective team working, such psychological safety is associated with building trust, a sense of safety, and also helps us to develop new and improved ways of delivering care for the women that we serve. So compassionate leadership, I think, is at the core of our ability to deliver high quality care and create cultures that ensure high quality, continually improving, compassionate care for the women we serve, and high quality, continually improving and compassionate care for the staff. But in order to have the resilience and the capability to be compassionate, I think it's important that leaders, first of all, practice self-compassion. We have to, I think self-compassion is at the core of our ability to be compassionate towards others. That means, as leaders, that we have to pay attention to ourselves. We have to understand the challenges we face in our work and in our lives more generally. We have to empathize with ourselves, to care for ourselves. We are a unique being in this extraordinary mystery of existence, and we deserve care as much as anybody else. And we have to then take intelligent action to help ourselves in order that we can be the best that we can be and stay close to the core values that give our lives meaning, like compassion, wisdom, courage. And that enables us then to have deeper and more authentic connections with everybody that we lead in our work, and in fact everybody we interact with. So self-compassion is at the core of our ability to be compassionate as leaders. So thank you for the privilege of sharing these thoughts about compassionate leadership with you, and once again for the privilege of being able to be involved in this conference. Thank you, Sheena.
Thank you so much, Michael. I just absolutely couldn't just couldn't stop listening so intentively to that. Your voice and the way you describe all the things that your knowledge is just immense, and I'm really grateful for you sharing it with us, especially for maternity services. Thank you so much. Thank you so much to Michael for giving the overview of compassionate leadership. And what I'd like to do now is present sort of how that can relate to maternity services even more than Michael's mentioned already, by providing some examples of how I've seen it personally in practice, and how I've come to realise that this is something that is a really huge interest to me, and how I feel that I can maybe help others to realise that too. So this is just to kind of give a little bit of a background to my career, and all these photographs represent a part of my journey really in understanding what compassionate leadership is. The top left-hand corner is the fact that I'm a mum, and this is me with my 4 children, but I'm also a grandmother of 9. So I'm embedded in the kind of the human being of what life is about. So maternity services focuses on families and health and the future, and I'm kind of in that in my personal life as well as my professional life. The other photographs kind of demonstrate that on the bottom right-hand corner, here I am, a young student midwife in the 1970s, really with the world at my feet, but not really understanding kind of where I was going, but absolutely knowing that the response I got from having a smile and the interactions that followed from that smile and that kindness and that kind of reciprocity was just fulfilled me all the time, and it kept me going in the most difficult times. And during my career, I've had moments of absolute exasperation where I've almost left my job because, for example, I've been bullied incessantly. Even in senior positions, I was intimidated and bullied. And also I was at the centre of a huge litigation case. And during that time, I saw compassionate leadership and negative leadership sort of alongside each other, which kind of really made me think about what kind of a leader eventually I would want to be. Even though I didn't really have aspirations to be a leader, I eventually became a senior leader in my organisation. But the top right-hand corner is a photograph that really represents courage and compassion, which is what Michael has been talking about. And this was obviously in clinical practice, but there was a lot of leadership demonstrated here too, because this particular mother, Helen, she wanted to have her baby at home in water. And I'd never even seen a water birth, never mind to facilitate one in water in a woman's home. And this was in the early 90s. And so practice has advanced considerably since then. But I was very, very anxious about this. But because I knew that this mother really wanted this particular birth, and it was for many reasons. So she gave me a history of why she wanted this birth. And I had then a lot of compassion for that woman. And so I had to develop courage and conviction that I was able to do that. So with the right support, with the right leadership, and with my tribe around me, I was able to facilitate that woman's choice. And it was a bit of a landmark in my career, really, because then I became able to support others to do the same thing and to really link the two. Because actually the word courage has I don't know whether it comes from it, but if you look at the beginning of the word, it's cœur, which is French for heart. And so I can't imagine anybody that can have courage without the compassion for the feel and the feeling for the intent of what you want to achieve. So, for example, if you see someone being mistreated, then it's the compassion you have for them that gives you the courage to stand up for them, or at least it should be. And because I've had kind of different representations and experiences of leadership during my career, the bottom left-hand corner is a photograph of me as the head of midwifery of the service, where in the end, I became, I was in a position where I felt that I'd learnt from the good and the bad. So here I am listening with fascination, as Michael has just mentioned, really listening with intent to the midwives telling me their experiences. Now, as Michael already mentioned, this sometimes, well, very often takes courage, because midwives don't always tell you what you want them to hear, and they will tell you of the excessive workloads. And that does cause an enormous amount of pressure, an enormous amount of stress. So it's the way you deal with that information, the way you really kind of connect with those individuals that makes the difference, and then having the courage to deal with it and to do something about it. And in the middle is a photograph of Sue Down and I. So since we published the book, The Roar Behind the Silence, we have gone around the world actually delivering workshops on how to bring more empathy and kindness and compassion and respect into maternity care through simple acts of kindness. This isn't rocket science. It's nothing that's unachievable. It's actually something that's within all our grasps. And this is what we've been doing for several years now. And obviously with the pandemic, it's stopped, but we hope to continue online in the future. So my talk is really about the world. It's not just about the United Kingdom, it's about us all. And the fact that if we can hold that world in our hands, metaphorically, if we can think about the world in this way and everybody within it that's providing any type of support and care to others, then we really must think globally and not just within our own little sphere of practice. I know that most people that go into work in any type of healthcare, but this is about maternity services that go into work with women and families, that they want this outcome. If a woman chooses to have a cesarean section, or if she has a cesarean section because of the way that her labour has gone, then we want her to feel like this. Or if she has a baby in water or wherever she gives birth, that she feels overjoyed and she feels ready to begin her journey as a parent, as a mother, hopefully with family surrounding her to help her to begin this new life as a family together. Because actually the short and long-term implications of childbirth really are quite significant. And again, that's for another talk, but we have to remember that these moments are crucial, and that as midwives, as obstetricians, as doulas, as maternity support workers, we play a significant part in making or breaking this very moment. And so this is what we hope for, but it's not what we always get, because we know that throughout the world there is huge inequalities, and that in some countries there's too much medical intervention, such as our country and in the United States, for example, where very often this increasing intervention actually may come with significant trauma, and either psychological or physical. And in other parts of the world, there aren't enough resources. So women are suffering, they're dying, their babies are dying. Absolutely, it's appallingly, because the resources aren't there. So there's this huge gap. And what we're trying to do consistently is narrow that gap, so that everyone has use of the world's resources. But within that, there are complex issues, because even in countries where there may be some resources there, especially in low-income countries, there may be some resources, but women are choosing not to use them, and they prefer to have their life threatened and their baby's life threatened and using those services, because there is abuse and neglect going on from medical teams. So we've got all this going on globally. And we also know, even though this is an old reference, it's still used even now, and I assume that this figure that's given here is actually much greater, but around 30% of women finding that the aspect of their birth is traumatic is unacceptable. When I was a consultant midwife in Lancashire, I listened to women. I ran sessions for women who self-declared trauma, and I learned so much from them. And the issues were mainly around feeling lack of control, the way they were spoken to, the way they were ignored, which is neglectful. And we know as a result very often as lack of compassion and lack of resources and lack of support within the working environment. But we must address this. And whilst we have to look all the time at ways of supporting women who've been traumatised, we have to try to prevent it from happening in the first place. We've also got national reports telling us that there's the outcomes from inequity and injustice with the black and brown communities is again unacceptable. We've got women who are dying unnecessarily that are from black and minority ethnic groups. This is appalling, and it has to be addressed, and I know it is being addressed at the moment, but we're facing this on a daily basis, and this very often is down to individual racism, systemic organisational racism that has to be stopped. It's zero tolerance from any kind of racism in healthcare. And again, the counterbalance to this is compassion, which I'll come on to very shortly. So then we've had the pandemic, which has affected us all in our personal lives and in our professional lives. And as Michael has alluded to, it's really kind of shown when there has been a sort of compassionate response and sometimes the opposite. So we should learn from this all the time and really think about what matters to you and your family when you're either going through some kind of trauma or going through health services or indeed having a baby. You know, what is it that matters to you? What do you want from your healthcare workers? And that's the thing that we should be trying to provide. So we know that women's rights have been erased during the pandemic, which, you know, probably the repercussions of this is going to last forever. And we must kind of try to rewind and think, what is it that really, really makes a difference to mothers and families, and fathers, parents, anyone that's involved in the childbirth experience? What is it that matters to them? And these things are having a negative impact on their lives. So the World Health Organization is very clear, and many of the international organizations that kind of give us not only the evidence, but also the resources and the messages that we can put out there, that everything that we do really is around making sure that the woman has a right to a safe and a positive childbirth experience. Safety and positive they're actually integral. So how a woman, the safety really encompasses a woman's personalized experience, what matters to her. Safety is very individual. And so how she feels, how you look at her, how you touch her, how you speak to her, everything has an impact on the safety of that mother and baby. And then we have the feedback, like we've already heard, about the impact that this pandemic has had on the staff. And almost on a daily basis, I hear from midwives, I hear from senior midwives, from juniors, from students, from obstetricians, who are telling me the incessant struggle to maintain that autonomy that Michael talked about, that satisfaction. How can they possibly feel satisfied when they're not able to practice and give the appropriate care? So again, it's turning back to what really matters to those staff. Is anyone listening to them? Is anyone paying attention? Because this really makes a difference to how those practitioners are able to then interact with the women they care for and the families. We've got the Wellness study that came out a couple of years ago from the Royal College of Midwives that show us very, very clearly that midwives are feeling overwhelmed, the work-related burnout, they're stressed, they're thinking of leaving. And again, that's showing in the figures. Obstetricians as well and gynecologists. And this is taken from that report that says, 36% of obstetricians met the criteria for burnout and were 6 times more likely to experience suicidal thoughts. This is absolutely diabolical. 4 times more likely to report depression than other doctors, and 3 times more likely to report anxiety, irritability and anger. And interestingly, underneath that, it says 4 times more likely to practice defensively, which again contributes to the too much too soon agenda that we heard from, that we saw the paper in the Lancet, that we have to keep remembering that sometimes we're doing things because just in case, because we're fearful of getting into trouble. We're fearful of a litigation case. We're fearful of the sort of powers that be that come down on us, or being in the press. So doing things when really they don't need to, which can cause, again, short-term and long-term harm to that mother, baby and her family. So it's well known, the RCRG is saying it's well known that we need to move beyond traditional cultures of endurance and stoicism, which has already been talked about. Do you know this kind of, oh, you've got to be resilient, or you've got to be strong, or you've got to be, if you don't put up with this, if you don't do it, then it means that you're not going to make the grade. And I can remember in my career having that said to me and feeling that I had to put up with bullying because that was part of the culture. Midwives used to say to me, oh, don't worry about it, Sheena, she does it to everyone. That is unacceptable. And so how you learn from that, so I'm going to come on to some of the things you can do sort of as a practitioner, but if you're a potential leader, which we all are, we all have that ability to lead if we're in the right environment, then it's about all of us. It's about all midwives, all obstetricians, that we can learn from that negativity by not doing it, by role modeling different behaviours, by really counteracting that horrible negative culture that sometimes exists. So moving on now to what we can do as not just as leaders, but as individual practitioners, we can really focus on however a woman gives birth, she is a human being. The humanization of childbirth means thinking about the relationships, the positive relationships, the nurturing relationships, moving away from unnecessary technocratic organizations. So look at the top picture where you can see an image of a woman and her partner and the baby there in skin to skin after an emergency cesarean section, and you can see that the bubble that they're in, the little huddle underneath the sort of the cloth, the drapes, that's their beginning. That's how it always should be. You can imagine that probably, but we can't be sure, that woman, well, I know she wasn't traumatized by that experience. And again, below a photograph of a home birth that's taking place where a midwife is nurturing the woman. Now, for this to happen, they need to be in a nurturing environment where this is allowed, where this is permitted. And I use the word allowed very cautiously because we're often bogged down with whether we're allowed to do things or not allowed. And that's a big bugbear of mine. I often say that maternity services shouldn't allow the word allow, because we should have the freedom to be able to practice intuitively, we have to have the right appropriate skills, but it's the love that we give and it's the nurturing that we give that makes the difference, not only to those we care for, but to those we work with. So this is an example of kind of showing the difference between medicalized, industrialized care and humanized care. And I, not to go through the whole thing, it's actually published in the Practicing Midwife Journal, but not to go through it, but to actually show that mainly it's based on relationships. So when we keep moving towards relationship care, relationship-based care, relational intervention, keeping the mother and baby together, supporting the midwives to support the mother, that's when humanized care becomes a reality. And compassion and courage are connected. There's no doubt about it. Those two things go together. Paul Gilbert is very clear that, compassion isn't about weakness. It's about strength and courage. And it's the most important declaration. I love this quote, particularly when we've heard about the inequality and injustice with the Embrace report, with the Black and minority ethnic women having poorer outcomes than their babies. Do you know, this is showing that actually it's a universally recognised language. So if some of the barriers to those inequalities are language, then we have the perfect language that really transcends all cultures, all race, all colours. Because if we show compassion and kindness and respect, then these things, I'm sure, will diminish. These inequalities will diminish. I love this photograph. This is a midwife. It's actually taken from an NHS video showing the connection between a deaf woman having her baby and the midwife. And just look at this midwife's eyes and her face and the encouragement she's giving. And this is a quote that I gave when I received an honorary doctorate at the University of Central Lancashire. I kind of used this at the end of my talk, that remember, love and science are the two most important things, and the skills you have and build on are fundamentally important, but the kindness and compassion you show will make the difference. And your eyes tell a story to the people you care for. And while this is about a clinical interaction, think about if you are a leader in any position, or if you want to be a leader, think about this face and think about those things when you're talking to the individual colleagues that you work with. So if you remember that, if you remember this face, this kind of, this intent, this being present, this listening with fascination is all part of the interaction you should be having with your colleagues. And if you sometimes find it hard to do, think about those role models that you have in practice, those individual practitioners. There might be a midwife or a doctor who you relate to all the time, and you want to work with, who you want to be on a shift with you. They're the ones you want to be with. Why is it that you want to be with them? Usually they're clinically safe, but they're also psychologically safe. They provide psychological safety to you so that you can ask questions, difficult questions all the time, which is absolutely crucial to safe maternity care. So these midwives, I actually asked them if I could use their image. It was on social media, and they're talking about smiling behind the mask. And again, it's the eyes, isn't it? It's look at that. The eyes are the windows to the soul. So a very simple interaction that you can use. Just use your eyes, whether you're talking to your colleagues or whether you're talking to women you're caring for or their families or birthing people, whoever you're with, whoever you're interacting with, use your eyes and smile. Another book that Sue and I have published, we've edited together, is called Squaring the Circle, and it focuses on the physiology of childbirth and again brings into it the compassionate care that's important for that. And we've engaged with international experts from in the field, and this quote is taken from Sarah and Kirsten's chapter, which is really kind of, sort of making it clear that it's not just a nice thing, as Michael has alluded to, that being kind and being sort of connected does change the physiology. And it's so important for the physiology in the antenatal period, the intrapartum care and immediate postnatal care, that cocktail of hormones that's integral to a woman having a positive birth experience and also having physical as well as psychological safety really, really matters. So, it's there, the science is there. Susan Bailey and Michael West have got a plethora of resources that you can tap into on the King's Fund website. And of course, you've heard from Michael this morning, but just go on and have a look at there's videos, there's fabulous blog posts that really give you the evidence behind the importance of compassionate leadership. And this seems to me like the answer. And even though I'm just learning more and more about it as I go along, I've actually physically felt it and physically practiced it in my work. So I know that it's there, and I know that it can make a difference by the simple things we do and by the strategic things we do. Compassionate leadership is the answer. So I beg you to remember who you are. So when I was brought up as a little girl, I had a strong mum and father who taught me some values, some kind of, how to be right to others, how to be kind to others. And that's what I've always tried to remember in my practice. So remember who you are. Remember the things that you what kind of things you said when you went for your interview to be a student midwife, or when you went for your job just recently to be in a senior position. And keep going back to those values, keep going back to them. Don't tap into negative culture. Just, keep this at the center of all you do. Looking after yourself has already been mentioned, and sometimes I forget this, but we can't look after others if we don't look after ourselves. Some folks now in maternity care are kind of criticising this and saying, oh, this is just being bandied about, it's a bit of a cliche, how can we look after ourselves if we haven't got time? But you have to make time. You have to have those moments, and different things work for different people. Find out what helps you to feel good about yourself, and make sure that you do care for you, because you are your biggest resource. You are the one that matters the most in your life, and you really have to take great care. Love without expectation. This is kind of thinking about, don't always think, oh, if I do this, I'll get that. Try to think that the fundamental kind of human kind of sense is of love, and we've talked about compassion already, and the two go hand in hand. And certainly when I think about love, it's not about being in love, it's about loving what you do, it's about loving the person in front of you. And sometimes we don't like the person that we're working with, or we find them aggravating or irritating, but it's how can we get around that? Thinking about how can we get around that? Doing something kind for someone every day, really doing that simple act of kindness. Not only, Michael's already mentioned, not only benefits the person you're being kind to, but also to you. It rewires your brain. It helps you to be more resilient. The kinder you are, the more it bounces back. So really, as a leader, do this as well. If you're in a position of authority, or whether you're working on the ground with sort of just with your colleagues, not just, but with your colleagues, then really try to interact in this kind of way. I know we're not allowed to hug at the moment, but we can show kindness in different ways. And acting with compassion. So this is something I think I try to talk to all practitioners about, but and if you're a leader, remember to do this as well. So when you see something, when you see something happening like this midwife facilitating this birth, tell her how you appreciate what you've done. Very often we don't hear words of appreciation from others, we just hear the negative. But take time to appreciate and say, what I saw you do then really made a difference. I saw that it made a difference. It has to be authentic. It's not just about saying, oh, you're marvelous, you are. It's about really picking up on that small interaction that you saw that makes a difference. Then commend them. So commend them in front of others if you can. Tell others what they've done. And then ask them to teach what they did to others. And what happens then, the ripple effect of that, so the fact that you've actually appreciated, that you've commended them, and that you've asked them to teach others, actually makes a massive sort of impact. And when I say massive impact, I can actually, if I had more time, I could give you examples of where I've seen this really work, where it's not just shifted a sort of the culture within a particular time frame on a shift, for example, but it's actually shifted cultures within teams and within organisations. So it really does make a difference, and something that I'm hugely aware of and feel very, very passionate about teaching it to others. Listen with fascination. We've already heard about this. This is really intently listening with your eyes, with your whole being present. And I show a little a Pinard stethoscope for those of you who are midwives who are listening. And on this Pinards, we were going to do some sessions with NHS staff before COVID hit. And we created these Pinard stethoscopes because normally we listen to the baby's heart with a Pinards. But on this, it says, listen with fascination. And we had that engraved because what we wanted to deliver the message of listen with fascination to the woman or birthing person that you're caring for, that you're connecting with, but also listen to the people that you work with, those you are leading, those you are collaborating with. Courageous conversations are a must. So compassionate leadership isn't about being kind, giving everybody what they want, being soft, being a pushover. It's about also having those difficult interactions that you sometimes dread. Now, as a compassionate leader myself, and I tried to practice this in my time as a senior midwife, what I found was that it was easier to have a difficult conversation with those I worked with when I'd already been shown them compassion. So when I was a nurturing, intuitive leader, which I tried to be all the time because I tried to emulate some of the positive leadership styles I'd seen, but I also tried to be the midwife to my colleagues. I tried to midwife them, and so I would act like I would with a person in my care. What happened then was I got when I had to have difficult conversations, these individuals would listen to me more intently and didn't get sort of angry with me for having these conversations. So it does work. It makes a difference. And you know yourself how you'd feel if someone who you normally hear positive things from gives you some critical feedback, then it's more acceptable in some way. Building relationships is integral to compassionate leadership. Here we have a picture of an obstetrician on her knees facilitating a forceps birth. Never been heard of before in the organisation. I talked about this at the Royal College of Obstetrics and Gynecology once, and this is a mock-up of it happening, so it's not actually when it happened in live, but this is showing how the relationship between the midwife and the obstetrician, they talked about how this woman did not want to be on the bed beforehand. The obstetrician was compassionate. She was also courageous because none of her colleagues had done this. This is Liz Martindale, who is probably one of the most compassionate leaders in the field of obstetrics, because she would do these things. She would work with a woman. And what does that teach everyone else? She's leading other junior obstetricians and showing them that being compassionate can help you to be courageous. Gather your tribe around you, whether you're a leader or a practitioner, gather them around you. This isn't about it being exclusive or forming cliques. It's about being inclusive and saying, come on, let me help you. How can I help you? We can share things with you. We can help to change things here. Let's make a plan. And being brave, we've already talked about. Very often I felt like the cat and I had to pretend I was a lion. And it's not always easy and it doesn't always work, but being brave is part of it. Use your voice, whether you're a student midwife, leader, whatever position you're in, use your voice, because that you really do. Everyone matters. We all have a place in society. We all have a place in healthcare, and it's our duty to speak up if we don't have the right resources, which I'll come on to. Start a book club. You've already heard about some books already. Find out more about different books that you can read and share with others. It's a very good way of quickly learning when you do it within a book club. And this is part of being courageous and compassionate. And again, it's something that I talk about all the time. Keep those you serve at the centre of your actions. Speak up for your rights to have enough time and resources to provide the care you are qualified to give. And I'm still doing this at a senior level. I'm still doing this at a policy level, speaking out for midwives, speaking out for obstetricians, because we have to keep on going with that. So the future is very important. And of course, we're all looking to the future right now. And salutogenesis that focuses on well-being and thinking about what works, what's the positive things that work. Let's, rather than always focusing on the bad things, which we've heard about and we have to face and we have to recognize, let's look to what really works and ask people who are doing good things, how did you do that? What can we learn from you? And this is where we should really try to focus on. Hold on to inspiration. So to be transformational leaders, to be transformational organizations, we have to hold on to that inspiration. This is a photo of just amongst all those midwives. This is a midwife called Lucia Rocca. She's a Spanish, half Italian, half Spanish midwife that has worked in the United Kingdom. And this was taken last year at a conference in Barcelona, where she brought together midwives from all around Europe who were being constrained in their practice She's a leader of global midwives, and she doesn't even know it. She does it with courage. She does it with compassion because she worries about what's happening to mothers and babies in Italy, in Bulgaria, in many, many European countries where women's rights are being abused. And so she did this with her tribe. She brought everyone together, and I chaired this conference, and I was so proud. And my husband took this photograph because it represents really what leadership is about, what compassionate leadership is, and that is Lucia Rocca. This is Nellie, this isn't actually Nellie, I never took a photograph of her, but this is an image of a cleaner who I worked with, and told her what an amazing leader she was, because she was so compassionate, not only to the individuals who tried to walk across her cleaning on a busy corridor, but to the staff, and to her colleagues. So what she did is she modelled the behaviour of compassion by smiling, by saying, don't worry, come this way, I'll show you how to get across safely. She was so positive that I used to long to see her every day. And every time I saw her, she made me smile. So what she did is she had an impact on me. She had an impact on her colleagues because they started to be like her. And she had an impact on the patients that visited that hospital. So I actually nominated her for an award and told her constantly how I appreciated her, I commended her, and I asked her to teach others. So it's not just about those in senior positions. This is about everyone. We're all in this together. And Evita Fernandez, who is a wonderful obstetrician who is changing the face of midwifery in India with her colleagues. And she's instigated that, even though she's an obstetrician, because she suddenly saw the light around practice and the way practice was going in India. And I want to just tell you one little story about Evita. When I was in India last year doing a Roar Behind the Silence workshop with obstetricians there, and Evita's family started some private hospitals in India many, many years ago, and she's built on that. She's now got a foundation. So she's sharing the benefits of these hospitals with the communities. But the thing that struck me about her leadership was that when she was in any of these hospital settings and she was showing me around, she had a lot of staff working in there. So she had, for example, she had someone opening a lift, someone closing a lift, someone taking you up in the lift. And to me, it seemed really excessive. And I asked her why she had so many staff. And she said she wanted to give as many people jobs as possible because obviously it made a difference to lives in her community. But the thing that she did that really struck me was how she knew everybody's name. She stopped and they treated her like she was a queen because, of course, she owned the hospital. So each individual worker that was in that hospital used to bow their head and say namaste, and they were very subservient to Evita. But she treated them with the utmost respect. She was on their level, even though she was the owner and the master and mistress of this establishment. She was with them in person. She listened to them. She asked them about their families. So it took ages for us to get round there. And actually, I found myself crying because I just loved these interactions. They were totally phenomenal. And I wanted to be like her in every way. So if we focus on safety and not on risk, and on relationship-based care and not on system-based care, we can make maternity care safer for everyone, for women, health professionals and organisations. And I love this quote from Hannah Darling and use it wherever I go. Don't wait for others, be the change you want to see in the world. Thank you so much for listening, and I wish you well, and I hope to hear from any questions you may have. Both Michael and I are willing to answer them by email after this session. So thank you so much.